Now we're going to kind of meet the winning companies. About 90 seconds each for them to introduce themselves, what problem they're solving, how they're solving it, what are some of their accomplishments to date. I'll try and ask a smart question to follow on.
Hi, everyone. I'm Dr. Monica Roots. I'm the co-founder, president, and chief medical officer of Bend Health, and I'm a child psychiatrist. As we know, there are 71% of counties in the US that don't have a child psychiatrist. In fact, most of the brunt that's being felt today is by the primary care physicians. They are really dealing with the mental health crisis of youth that we see today. 1 in 5 kids and teens experience a mental health concern, but as a mom of two, I can tell you 100% of kids and teens will experience some sort of stress that they need support for. So we are a national youth mental health service addressing needs for those ages 1 through 25, taking a really family systems approach. So including the caregivers within their care, because as we know, a child is highly dependent on their ecosystem. We have a full spectrum of services to be able to support them. So 3 main things that we try to solve for is access. And we partner directly, very closely with pediatricians and family physicians to be able to get them into care very quickly. But we are also available for about 95 million people through plans, our health systems, employers, and self-pay options. But we have all sorts of services to be able to support them, from subacute needs, so everyday stress, all the way up through more SMI concerns through our services. And we really utilize a collaborative care model. So we have behavioral care managers, coaches, therapists, and psychiatric providers to address our needs.
Terrific. My wife's actually getting a master's in mental health and counseling right now, and in the high schools, managing kids. How have you? What do you measure compared to sort of standard psychiatry and psychology using Bend?
We actually use 16 different measures that we capture at baseline, but also monthly to be able to track progress. So that's everything from screening from depression, anxiety, ADHD, oppositional concerns. We also measure tech use. We measure things like caregiver stress, caregiver burnout, and caregiver insomnia. And of course, also measure for social determinants of health. All the things that are really important for us to not just measure the impact that we're having at the child, teen, or young adult level, but also see the impact that we're having in the family system level, which we know that if mom, dad, or caregiver are not okay, or they don't have access to food, that child does not have the ultimate potential for success and outcomes.
As we know, again, I'm trained in pediatrics and internal medicine, but we've also seen a dearth of solutions in the pediatric space, or they don't get adopted or paid for, just like in the challenges across the adult world. What lessons have you learned that are unique to getting solutions out into the kids space, whether it's a pediatrician, physical therapy, and beyond? Any kind of quick lessons or insights?
One of the biggest issues in mental health, and many of the pediatricians on this line probably know, is coverage of mental health care. And especially given that a lot of kids are on Medicaid. So one of the biggest things that we wanted to do when we approached health systems was be able to utilize a code that was nicely covered for the majority of their patients. And so in 2019, collaborative care codes were approved by CMS, and those are the main codes that we utilize. Because when we go then to a health system, if that PCP is credentialed with an insurance company, that service is covered. So therefore, the pediatrician does not have to navigate, does this insurance be covered by Bend, or is this one? And that really has been a huge unlock for us, though, because it is new, it requires education and really being able to support their billing departments. So that has been our challenge, but also our fight, because we know that we want these kids to be able to get the access they need.